Occupational therapists are skilled professionals who help us carry out activities we need or want to do. They help people of all ages, babies, children, adults, and as we grow older.
Hello, my name is Joe Reagan, and I work as an occupational therapist with Select Physical Therapy here in Pensacola. Very often I'm asked what is the difference between an occupational therapist and a physical therapist. The main difference really is that an occupational therapist is going to work mainly with upper extremity and with utilizing functional types of tasks in order to achieve goals, whereas a physical therapist would use more of like an exercise-based treatment program to achieve essentially the same means, but they just may be working with different pathologies.
You have to be able to communicate.
Motivate.
Every experience is different.
There's no cookie cutter approach.
And it's rewarding.
I strengthen.
Enable.
I treat.
We heal.
You're helping those who can't do.
Caring.
Educating.
Encouraging.
Just helping people.
Funulating.
You need to go in with a completely open mind because something very cool might come out.
I can see that I will remain independent for years to come, which I couldn't see before I had occupational therapy input.
Give me therapy. I'm a walking travesty, but I'm smiling at everything. Therapy, you were never a friend to me, and you can keep.
Hi, my name is Sarah Kate Fry, and I'm an occupational therapist at Kernan Orthopedics and Rehabilitation in Baltimore, Maryland. I actually got into OT kind of by accident, doing some volunteer work at a state hospital for people with mental retardation in Pennsylvania. And I met an OT there, and she told me about it, and initially I thought I wanted to work with children, but once I started my program I realized I really had an interest in working with people with spinal cord injuries, and so here I am today. Here on this unit we do, we have two separate rehab units, but the therapists work on both of them. So one is spinal cord multi-trauma, which is people with spinal cord injuries or people who have been in accidents and have multiple orthopedic injuries, like if they break an arm and a leg or something like that. And then we also have comprehensive medical rehab, so it could be anybody who fell at home or had back surgery, hip surgery, knee surgery, anything like that. Typically in our workday we would start off in the morning looking at patient charts and getting ready for the day. Then we treat, depending on the day, we usually treat between 5 and 6 hours of direct patient contact, but we might see 1 or 2 patients at any given hour. Here we do both individual and group therapy. Then at lunchtime we would have meetings, whether it be team meetings or training with a family. Some of us teach patient education classes. Then again in the afternoon it's more therapy, and we have time at the end of the day for documentation. The best thing about this job is getting to meet all of the different people who come in who are patients. We get to meet people from all walks of life. On this unit we take people as young as 15 or 16 and as old as 103 is the oldest I've worked with.
Wow.
So you get to meet all different types of people, and everybody has something different to share.
What is the most rewarding part about your job?
Definitely like getting to know people and their families and helping them to get better.
Send it on